Hello and welcome. Today we'll be discussing phimosis, a condition affecting the male reproductive system. We'll explore what it is, its causes, symptoms, and available treatments. This video provides general information and should not be taken as medical advice. Always consult with a healthcare professional for diagnosis and treatment. Phimosis is primarily caused by a few key factors. In children, it's often a natural condition known as physiological phimosis, present from birth and usually resolving on its own. In older individuals, it's more commonly acquired or pathological phimosis. This can be caused by chronic inflammation, repeated infections like balanitis or balanoposthitis, inflammation of the glands and foreskin, respectively, scarring from injuries or forced retraction of the foreskin, or certain skin conditions like lichen sclerosis. Uncontrolled diabetes can also increase the risk of infections, contributing to phimosis. Let's delve into the pathophysiology. Normally, the foreskin should retract easily over the glans penis. In phimosis, the foreskin opening is too small to retract. This can occur because of a fibrotic ring forming at the tip of the foreskin. This ring restricts movement and prevents retraction. In cases of lichen sclerosis, the skin of the foreskin becomes thickened, whitened, and scarred, further reducing elasticity and hindering retraction. The inflammation and scarring associated with infections also contribute to the inelasticity of the foreskin, preventing it from retracting. Phimosis has a varied prevalence depending on age. Physiological phimosis is very common in newborns and infants. Studies suggest that the majority of uncircumcised male infants are born with a non-retractable foreskin. This prevalence decreases significantly with age. Acquired phimosis, on the other hand, is less common overall, but its incidence increases with age and is seen more frequently in men with diabetes, chronic skin conditions, or a history of recurrent balanitis. The signs and symptoms of phimosis vary depending on the severity. In mild cases, there might be difficulty or discomfort during retraction of the foreskin. More severe cases can cause pain during erections, difficulty with urination, including a thin or weak urine stream, or ballooning of the foreskin during urination. Poor hygiene can also lead to infections and inflammation under the foreskin, causing redness, swelling, and discharge. In severe cases, phimosis can even interfere with sexual function. Diagnosing phimosis usually involves a physical examination by a doctor. The doctor will assess the degree of foreskin retraction and look for any signs of inflammation, scarring, or skin conditions. The doctor will also inquire about the patient's medical history, including any history of infections, skin conditions, or diabetes. In most cases, a physical exam is sufficient for diagnosis. Further testing is typically not needed unless an underlying condition like lichen sclerosis is suspected. In such cases, a biopsy may be performed. Phimosis can be classified based on its severity. A common classification is into grades, ranging from grade 1 where the foreskin can be partially retracted to grade 4 where the foreskin cannot be retracted at all. Another classification differentiates between physiological and pathological phimosis, as discussed earlier. Physiological phimosis is the natural condition in infants, while pathological phimosis results from infections, inflammation, or scarring. Treatment for phimosis depends on the severity and the cause. In children with physiological phimosis, often no treatment is needed, as it usually resolves spontaneously. Topical corticosteroid creams, applied to the foreskin, can help to soften and stretch the foreskin, allowing for easier retraction. Gentle stretching exercises can also be performed. If these conservative measures fail, or if the phimosis is severe or causing complications, circumcision, the surgical removal of the foreskin, may be recommended. For acquired phimosis, treating the underlying cause, such as infections or skin conditions, is crucial. Circumcision remains a common treatment option for adults. Preventing phimosis involves maintaining good hygiene. Regular washing of the penis, including gentle cleaning under the foreskin when possible, can help prevent infections and inflammation. Avoid forceful retraction of the foreskin, as this can cause tears and scarring, which can lead to phimosis. For individuals with diabetes, managing blood sugar levels is important to reduce the risk of infections. If you notice any signs of inflammation or discomfort, seek medical attention promptly. The prognosis for phimosis is generally good with appropriate treatment. Most cases of physiological phimosis resolve on their own or with conservative treatment. Acquired phimosis can usually be successfully treated with topical medications or circumcision. Recent research is exploring alternative surgical techniques to circumcision, such as preputioplasty, which aims to widen the foreskin opening while preserving the foreskin. Ongoing studies are investigating the effectiveness of different corticosteroid creams and stretching protocols for conservative management. Thanks for watching. Remember to consult a healthcare professional for personalized advice and treatment.